Welcome to Science Force, where science comes alive.
Okay, let's dive right into this. A very warm welcome to today's explainer. I am absolutely thrilled to be your guide through this fascinating topic. Today we're taking a close look at something you've very likely seen, or perhaps even experienced yourself, but might not fully understand from a mechanical standpoint. We're talking about varicose veins. We are going to unpack the pathophysiology, the diagnosis, and the management of this incredibly common vascular disorder. Basically, we're going to break down exactly how our biological plumbing works, and more importantly, how it sometimes fails. 20 to 30%. That is a staggering number, isn't it? That's the percentage of the adult population affected by varicose veins. So if you've been feeling a bit of heaviness in your legs lately or noticing some twisted veins, you are certainly not alone. While women are affected more frequently than men, this is very much a global phenomenon. And a lot of people tend to brush this off as simply a cosmetic issue. But as we'll see today, it is a genuine, physical, mechanical breakdown. Here's our roadmap for today's explainer. Anatomy of leg veins, normal circulation, how they develop, causes and symptoms, diagnosis and CEAP, modern treatments. Section 1. Anatomy of leg veins. The blueprint of lower limb plumbing. Before we can understand the disease, we really need to establish our baseline, and this brilliantly illustrates the workload of our venous system. Your deep veins handle a massive 90% of the returning blood. Meanwhile, your superficial veins, they manage just 10%. This is a dramatic difference, and it's absolutely crucial to keep this in mind as we move forward. Let's contrast these two systems for a moment. Your superficial veins are located right beneath the skin. This actually includes the great saphenous vein, which happens to be the longest vein in the human body. Because they're so close to the surface, these are the ones most commonly affected by varicose veins. On the flip side, the deep veins, like your femoral vein, are safely tucked deep within your muscles. That muscle surround makes their blood flow highly efficient. Now, connecting these two systems are the perforator veins. You can think of them as one-way trapdoors that direct blood from the superficial system inward to the deep system. When those trapdoors fail, well, that's when the trouble really begins. Section 2. Normal circulation. Defying gravity. This whole process is literally a story of fighting physics. Unlike your arteries, which have the powerful beating heart pushing blood downward, your leg veins have to push blood upward. They're fighting gravity every inch of the way. So how do they manage it? Through 4 brilliant mechanisms. First, we have bicuspid venous valves that open to let blood up and then snap shut to stop it from falling right back down. Second, your calf muscle pump. As you walk, your calf muscles contract and physically squeeze those deep veins. We actually call the calf the second heart. Third is the respiratory pump, where your breathing creates a sort of pressure vacuum that draws blood upwards. And fourth, healthy elastic vein walls that can snap right back into shape. Section 3. How they develop. The system breakdown. So what exactly happens when those gravity-defying mechanisms fail? Well, the crucial point here is venous reflux. This is the foundational trigger for everything we're discussing today. When those little bicuspid valves we just talked about become weak or damaged, which could be due to aging, genetics, or prolonged pressure, they fail to close properly. Instead of moving purely upward, the blood flows backward when you stand. It's just a fundamental structural failure of the plumbing. We can trace this failure through a very clear 6-step cascade. Follow along with me here because it's a bit of a vicious cycle. Valve damage. The initial valve damage occurs. Venous reflux. That damage leads to venous reflux, the backward flow. Venous hypertension. Because blood is pooling, hydrostatic pressure builds up in the leg. Venous dilation, this immense pressure physically stretches and widens the vein wall. Worse reflux, This is where it really snowballs. Because the vein has widened, the valve leaflets are pulled further apart. They can no longer touch each other, which causes even more reflux. Insufficiency. Ultimately, this whole mess cascades into chronic venous insufficiency, where the persistent high pressure begins to damage the surrounding skin and tissues. Section 4. Causes and symptoms. The triggers and signs. So who's actually at risk for this system breakdown? The risk factors are quite diverse. Genetics play a massive role. If your parents had weak vein walls, there's a good chance you might inherit them. Aging naturally decreases vein elasticity. Pregnancy brings a surge of blood volume and hormones that relax vein walls, not to mention the physical compression from the uterus. Obesity adds sheer physical pressure. But take a close look at this one: prolonged standing. For the teachers, nurses, surgeons, and security guards watching, standing still for hours creates immense hydrostatic pressure in the leg, simply because you're not using that calf muscle pump. Now, how do you spot it? The early symptoms often start very subtly. You might eventually notice visible twisted blue or purple veins right beneath the skin. But honestly, long before that, many patients report a very familiar micro-narrative. It's the end of a long day. You come home from work and you feel a vague, mild discomfort, just a distinct feeling of heaviness or tiredness in your legs. You literally just want to sit down and put your feet up. That right there, that is the hydrostatic pressure talking. If ignored, the disease doesn't just stay as a mild ache, it progresses. We're talking about aching pain, a throbbing or burning sensation, and intense itching directly over the veins. For our medical students tuning in, pay special attention to night cramps and restless legs, often coupled with swelling around the ankles. These symptoms are heavily exacerbated at the end of the day or in hot weather, and they represent a massive, massive drop in a patient's overall quality of life. Section 5. Diagnosis and CEAP. Assessing the damage. Now, what's really fascinating about this slide is the technology. Obviously, a physical exam is important, but the absolute gold standard is the duplex Doppler ultrasound. It is completely non-invasive, yet it acts as our ultimate window beneath the skin. It allows doctors to actually visualize the veins, map out the entire anatomy, detect the exact location of venous reflux, and assess valve function in real time. It literally lets us see the unseen. Once mapped, clinicians use this beautifully structured table to grade the severity, the CEAP classification. It stands for clinical, etiologic, anatomic, and pathophysiologic, but let's just focus on the C scores for now. Notice how the severity escalates step by step. It starts at C0 with no visible signs, moves to C1 for tiny spider veins, C2 for true varicose veins, and C3 for edema or swelling. By the time we reach the later stages, it gets serious. C4 brings severe skin changes, C5 is a healed ulcer, and C6 is an active open venous ulcer. It's a highly precise, standardized way to track the disease. And if we do reach those higher CEAP stages, we encounter some severe complications. We're looking at chronic venous insufficiency and painful venous leg ulcers that are notoriously slow to heal. We see superficial thrombophlebitis, which is essentially inflammation and clot formation. The veins can even rupture and bleed from very minor trauma. And for the life science students tuning in, note the term lipodermatosclerosis. For everyone else, this simply means chronic inflammation causing the fat and skin of the lower leg to become severely fibrosed. It gets hard and tight, almost like wood. Section 6. Modern treatments. Repairing the machine. Fortunately, medical science has developed incredible ways to manage this. Treatment absolutely always starts conservatively. The cornerstone here is graduated compression stockings. They're tightest down at the ankle and gradually loosen up as they go up the leg. They're quite literally assisting the veins in pushing that blood upward against gravity. Combining those with daily walking to fire up that calf muscle pump, elevating the legs above the heart for just 15 minutes a day, and avoiding prolonged sitting, doing these things can drastically relieve symptoms and slow the progression of the disease. But when conservative methods just aren't enough, we look to modern, minimally invasive procedures. Sclerotherapy involves injecting a solution directly into the tiny veins, causing them to safely close up. Then we have the really brilliant modern techniques, EVLA, endovenous laser ablation, and RFA, radiofrequency ablation. Guided by our trusty ultrasound, a tiny fiber or catheter is inserted into the vein. Heat from the laser or radiofrequency energy gently seals the failing vein shut from the inside. The body naturally absorbs it and smartly routes the blood to healthier deep veins. While those minimally invasive thermal ablations are the modern standard, traditional surgical options do still exist. Vein ligation and stripping, where the vein is tied off and surgically removed, is definitely much less common today. However, ambulatory phlebectomy remains highly useful. This is a procedure where small, bulging superficial veins are meticulously removed
through tiny, almost invisible skin punctures under local anesthesia, leaving minimal scarring. Ultimately, though, management builds directly into your daily life. Prevention is key here. While genetics are completely out of our control, our lifestyle is not. Regular exercise, maintaining a healthy weight, and staying hydrated keep the blood flowing beautifully. Wearing comfortable footwear and saving those high heels for special occasions allows your calf muscles to contract properly. And of course, stopping smoking protects your vascular health overall. Conclusion. And that brings us to our final slide and a provocative thought I want to leave you with. We have learned today that your leg veins are fighting gravity every single minute, and they rely heavily on your calf muscles as their crucial second heart. So whether you are studying right now in a library or standing on a busy hospital ward, what will you do today to keep your second heart pumping? Take a walk, do some heel raises, and protect your incredible vascular machine. Thank you so much for joining me on this explainer. Keep learning, and I will see you next time. Thank you for watching Science Force.